So may I just briefly just welcome you and the panelists. This is panel one. The title of the panel is COVID-19 Crisis and Communication Challenges in Thailand. So I will now pass over to Assistant Professor Warat Karuchit to introduce himself. He's a representative of our partner at NIDA, and this is a panel, convened by our colleagues at NIDA. So Ajahn Warat, over to you, and the time is yours.
Thank you, James, and good morning, everyone. Hello from Bangkok, Thailand. So we have the honor to be the first panel, and I specifically have the honor to be the first person to go up for this great conference. We are panel one, the COVID-19 crisis and the communication challenges in Thailand. So we'll tell you about the challenges in communication during the pandemic, or as the Yubon said, the infodemic and the misinformation and all the problems that ensue. We are from the Graduate School of Communication Arts and Management Innovation, the National Institute of Development Administration, or GSCM NIDA. Okay, our panel consists of 4 panelists, speakers, I myself, and next would be Kun Kittikun. He would be talking about the digital divide during COVID-19, the downfall of Thai citizens. What a grim look. Shouldn't be a very positive note, the downfall of Thai citizens. You have to listen to him. The next would be Kun Panyarat Wantong. He'll be talking on the topic of vulnerable groups and the stride of equal rights under COVID-19 crisis. And last but not least, will be Kun Ploy Sisuro. Very interesting topic, digital citizenship, the hand-in-hand practice of educator and parent during the COVID-19 pandemic in Thailand. We end on a positive note. That should be the way to do it. Okay, so let me start off my session by presenting mine. Okay, everybody can see my slides, right? Give me some response. Okay.
Yes, we see.
Okay, good. Now, my topic is communication crisis management during the pandemic. I will be talking about my experience with the communication crisis management in Thailand, with my duties of assisting the SOBOK or the CCSA, the main agency, state agency that tackle and issuing the measures that we all dread and we all hate and love. Okay, let's go back to last year, early last year. Okay, when the COVID-19 in Thailand was just starting, and it was starting to, we have increasing numbers of infected people. I was invited to give advice to, at that time, there was no CCSA or SOBOK. The government set up what is called the National COVID Team at the government house. And there were some problems with the communication. There was some mixed messages sent out to the public. So I was invited to give them some advice. So this is what I told them, what I presented to them on March 22nd. I said, okay, to be able to be effective in fighting COVID-19 with communication, you need this 6S model. The first one is you have to have a single command, because at that time there was no SOBOK or no CCSA. People do not know who to listen to. Okay, so you need to have single command. Second S is the single and steady message. Okay, it's not like one person says something and the next day another person says another thing. That cannot be done. The public will be confused. And you need also the tool of social monitoring of how people feel the mood of the public and the society, the concerns and everything. And the fourth S is social media communication, because it is the quickest way, the swiftest way to counter misinformation and getting through to many people who are not, using traditional media. And the fifth S is you need also the content to be simple, structured, straightforward, because we are dealing with 70 million people. You need to be as clear as possible, not using the medical jargons and hard to understand official languages. And lastly, the sixth S is you need to spread the same message. You need a network of communication, people, media, and you need to repeat the same message over and over again. Okay, so that was what I presented to them on the 22nd. And what happens next? On the everybody in Thailand might remember this. 3 days later, on the 25th, the emergency decree was announced by the Prime Minister, General Prayut Chan-o-cha. And from that act, that decree, came the Center for COVID-19 Situation Administration, or the CCSA, or in Thai we call it SABK, or in other countries might be the CDC or whatever. Okay, so this is the logo and the slogan of the CDC, the SABK, CCSA. And after that, the next day, the one day after that, the CCSA spokesperson was appointed with the team. We all know in Thailand, Dr. Tawisin Visanu-Yothin was appointed the spokesperson. So we have the single command with the CCSA and the single voice listening to Dr. Tawisin every day at 11:30 and now 12:30. And also I was appointed to be his assistant. Okay, so this is some of the pictures that I have involved over a year and a half with the COVID, the CCSA team, with Dr. Tawisin as the head of our team. Okay, so I will give you a recap of what we have done over a year and a half, and I will conclude with what I have learned during this experience. Okay, what we have used is that we were using both negative and positive messages according to the situation. We use negative messages. For example, we need to be serious about the not keeping our guard down, or being very careful and getting the shots, things like that. The negative messages to stress the seriousness of the situation. Now we have increasing numbers of infected people, and we need to be careful. You still cannot go out, things like that, and urge people to follow the measures. We have come up with, as so far, I think we have over 30 issues of measures in Thailand, the national measures. And we cannot only use the negative messages, but we need to also use positive messages to give hope and encourage people to maintain discipline. We all have heard about the term pandemic fatigue, right? At first few months, it was brilliant. It was very effective. People stopped talking, and the voices died down, and we all listened to Dr. Tawisin. But when the fatigue set in, the fatigue of staying home and lockdown, there are more confusions, because we want to go out, we want to start a business. So as Dr. Tawisin, he is a psychologist, so he knows how to give positive messages and give hope and encourage people. So my duty was also to find him the stories, both negative stories and both positive stories, to support and to support his live briefing, daily briefing of his COVID-19 announcement. Okay, so these are used strategically. Okay, today we try to use more on a serious tone, and this today we try to build people hope and do not give up. Also, we were using the strategy of having both messages that talk to the mass and various risk groups. We talk to all the people. Okay, everybody, here's what you need to do. Here's what the governments will try to do. And we also talk directly to some of the groups that are more risky than others. For example, senior citizens. Okay, what you should do, where you should go, who you should talk to. And factory workers for the factory sandbox, for the bubble and seal measures and other measures. And also the office workers, because office workers are one of the riskier groups of people in Thailand. So you need to talk to them directly. Okay, do not have dinners or lunch with your colleagues, things like that. And also, this is also a very key component of our communication strategy. We try to turn measures into simple rules. We try to turn the rules, the lengthy and official rules into simple message, simple words. For example, the new normal, ชีวิตวิถีใหม่ DMHT, distance, masking, hand washing, and temperature testing. อยู่ห่างไว้ใส่แมสกันหมั่นล้างมือ things like that. SQ, AQ, the quarantine, ALQ, whatever, HICI, home isolation, community isolation, and now lately we have many more new terms: universal prevention, COVID-free setting. Everybody will have to be getting vaccinated, fully vaccinated before entering the premise. And also we try to adjust the focus along the situation. Okay, for example, at first the aim was to get the COVID, the infected people down to 0 case, and we achieved that for a little while, and then it came back up. So okay, we need to talk about the necessity of the lockdown, because some people wanted the lockdown, some people hated the lockdown, right? So okay, here's why we need the lockdown. And maybe now in a few weeks we will be talking about reopening the borders, reopening Phuket, Krabi, Samui, and maybe Bangkok in a few months, in a few weeks. Okay, so lastly, the last thing I will talk about today is 5 lessons that I've learned from COVID communication from a year and a half. The first lesson is, in the long run, the truth shall set you free. There's no escaping from the truth. You can talk whatever positive aspect you can, but do not lie. Do not try to hide the truth. And be careful not to sugarcoat the bad news. Do not try to spin the bad news into the good news, because at this age and time, people will find out and people will punish you. Secondly, the second lesson is you can expect rumors and fake news. Be prepared with the facts and respond quickly. At first, we were trying to stop, eradicate, and get rid of the fake news, but it was impossible. You can expect the fake news to be abound and prevalent in any crisis situation. So what you can do the best is to be prepared with the facts. Whatever you say, there'll be someone who spin it in a negative way, especially when it became the politics, or as the title suggests, nationalistic issue, and try to respond quickly. And the third lesson is that be very understanding of people's frustration. In crisis, there'll be frustrated people and they will want to voice anger and their frustration. So be humble, even if you are not wrong, but you will be wrong anyway. And so avoid or don't blame others. Don't blame the people, and or don't use threats. Don't try to, okay, we will arrest you, we will whatever, we punish you. That will not go down well with the public, even if it's something that ought to be done. Accept mistakes if there is any, and apologize when needed. Express regrets and show responsibilities when you are wrong. Okay, and to do that, you need the crisis communication system, which are people, time, budget, network must be established. Something that I've learned is that Thailand is really not having the system in place. So to be prepared for the next, God forbid, the next crisis, you need the system to be in place and practice regularly in organizations. And there should be a central team and agency to oversee it, because there is none today. And lesson number five. Okay, I'll go over a little 12 minutes because I have some extra time from before, right? Try to be as transparent as you can. Provide open data as much as possible, because there'll be accusation of, trying to cover up some things, some data for the sake of the government or whatever. And transparency and open data and accessible data will promote people's involvement and can build trust in the long run. So this is some key lessons that I've learned. So now I present to you today the trust model of crisis communication management 2021, after a year and a half of learning the real life of crisis. One, the trust is TRUST. The first lesson, trust, truth must be told. Rumors and fake news must be responded quickly with facts. Understand people's frustration, avoid blame game, accept mistakes and apologize. The system of crisis communication must be established. And lastly, transparency and open data helps build trust and promotes involvement. And finally, before I end this presentation, together we get COVID. Isolated, we survive. COVID is still here, so keep social distancing. Thank you very much. Okay, so I've done my part. We will have the Q&A questions at the end of the panel. Next up, we have the next presentation will be Kun Kittikun Kakai on the topic of digital divide during COVID-19, the downfall of Thai citizens. Okay, so when you're ready, you can start, Kun Kittikun.
Yes, okay, I'm ready. And first, I would like you to share my screen, please. Now, okay, you see my screen, right?
Yes, we can see it. Okay. Very good.
Good morning, everyone. My name is Kittikun Kakai. I'm the PhD student of Graduate School of the GSCM Athena. Today, I would like to present in the topic digital divide during the COVID-19, the downfall of the Thai citizens. Digital divide originates from the evolution of the technology. Despite this advancement, the citizens are still unable to have an inequality on digital accessibility. As a result, there is a digital divide in the Thailand and the several countries around the world. Digital divide or the digital inequality is the gap between the people who have and don't have the information, including inequality in the computer and the internet access. In Thailand, a survey on the use of the communication and the technology in the household, and they found that the trend of the internet has been increasing from the 47% in 2016 to the 77% in 2020, while the population of the computer user tend to decline into 2016 to the 2019. And if you see this graph, the Thai citizens have the internet access 22% in the 2020, and the computer they access 74%. This is the digital divide. And the IMF observed the ASEAN digital divide, and they found that Brunei, Malaysia, and Singapore have a high level of internet access. But in developing countries such as Cambodia, Indonesia, and Laos, 70% of the citizens are unable to access to the internet. And the research also found that the cost of the accessing to high-speed internet from low to high were Singapore, Thailand, Indonesia, and Vietnam, respectively. From this survey, and they show that Thailand still has the digital divide, and digital divide during the context of the COVID-19 pandemic is the strongly affect the welfare and the safety in the lives of the citizen. There are several of the causes of digital divide. First is the information infrastructure. It was defined by inequality of the opportunity to the access to information infrastructure, including the power system, mobile phone, internet, computer, and the satellite system. Most of the time, the urban citizens have a greater access to the information infrastructure than the rural citizens. And the second is the individual factors differ from age, socio-economic status, education and digital skill, and the physical disability. For example, digital device as the computer and internet are the widely used in the higher education and the wealthy citizen. And some countries such as Italy often use the social media to express their skill, but poor citizens tend to avoid the social media. And the last cause is the government policy. The policy is very important because the government set the policy on the provision of digital service, provide competition, and the plan to develop information competition, the infrastructure. Moreover, digital divide can be explained with the two theories. Information knowledge gap theory explain that the segment of the population with the high socio-economic status or the privileged group tend to receive such the information at a faster rate than those of the population with the lower socio-economic status or the unprivileged group. And the theory is the resource and the appropriation theory. Explain that the adoption or the use of technology will take from a process known as appropriateness. It's considered the first step, start with the attitude, with the desire to use technology, and then the material access, developing skill, and the uses of the technology. Furthermore, the individual the characteristics and the status will differ according to available resources such as income, social network, and the social status are the reason of the unequal the first step or the digital divide. Digital divide of the Thai citizen during the COVID-19 pandemic. First is the disparity in the access to the information infrastructure. If you see the graph, this is the graph of the use the internet on the 2020, and they show that 22% of the Thai citizens know the internet access, but 22% mean that 14 million people is a lot of the people. And the Thailand government have the village broadband internet project, or the Thai called the Net Prasha Chat, but this project is not the successful. For this reason is to prevent the people from getting the support from the government, and they cannot receive fast and accurate information. Second is the individual difference. Citizens lose their income during the COVID-19. They purchase only for basic human needs. When you watch the news, a student hold umbrella to fight the internet the signal for the learning. And the Thai people have the group of illiterate group have a problem of using digital technology. And the third, inequitable access to the information and the government. People can support from the epidemic health information, government assistance information. In Thailand, the government established a center for the COVID-19 situation administration, CCSA, at the Soboko that Ajahn Varat said the last presentation. The organization that has published information report the COVID-19 epidemic and they suggest the citizen about the healthcare. If the citizen they can surf the internet and search on the social media platform like the Facebook, they will receive rapid information and keep up to date. And moreover, the many policies such as we don't leave each other and many more, which require to be related to the internet. These reinforce the digital divide. The last is the disparity in digital skill. A lack of the critical thinking skill that can lead to the fake news, the challenge, and they spend more time on the screen, which cause of the many diseases like the obesity, diabetes, depression, and the insomnia. Government have government program and policy to eliminate the digital divide. There are the many policies, such as the NBTC approved the policy to support citizens for the saving telecommunication costs, such as increasing the internet speed for the mobile phones and increasing broadband internet speed. And the last month, Thailand, the government approved 23 billion baht relief package focused on education and the paid money 2,000 baht hand out per child. And Thailand have this kind of learning through television, the channel or the LTV. And the national telecommunication company have the home broadband internet and the service with the spatial pipe. And some universities such as Chulalongkorn University and Thammasat University distribute internet SIM to the student. And neither school support the internet they explain for the 1,000 baht to the student. And I have to recommend for the reducing the digital divide of the Thai citizen during COVID-19 pandemic. First, have a clear and a practical plan on the information infrastructure support. The government should support free internet and all the low-price, high-speed internet services during the period of the COVID-19 epidemic, especially for the low-income citizens. In order to be the success, the government needs to collaborate with all internet service providers and offer tax reduction to them. And moreover, the government can integrate the village broadband internet project or the Thai Net Prachachat, Wi-Fi net of the town municipality, which had already been purchased. It can be used a free public network. And in addition, Wi-Fi, the hotspot service that can be installed on the car and the driven to the wireless the communities to share the internet signal to the citizen. Second is the instill digital skill to the citizen. The digital skill that can be educated through the social media, website, television, radio, and the newspaper. The most important of this skill is the critical thinking. The digital skill prevent from the misinformation, fake news during the during the pandemic. And moreover, the citizen also have to be the recommend website or the sources that can check the fake news, such as Facebook of Corfact Thailand and Anti-Fake News Center the Thailand. This helps the citizen to recheck the information before the challenge each other and apply the information for their own healthcare. Third is make use of the community. The same Thailand have the many the leader of the village, such as the village leader, sub-district headman, village headman, or the village head volunteer, the Thai call or SOMO, and the primary care. This group should be to involve to the solving the problem of the digital divide. For the example, they have to go to the area and to make sure that the people in the community get to the registers for the government welfare and teach people how to the registration, the government welfare, or act as a registered intermediary. And the last is the enhance the citizen participation. At the same time, Thailand established Digital Government Data Agency, or the GDA, which oversee or the control the information and data in the Thailand. The organization they can collaborate with the citizen and the private sector to eliminate digital divide or the exchange the information together under the Personal Data Protection Act. The collaboration lead to the many benefits, such as the transferring of live data to the online, managing the epidemic effectively, or allocate mass to the cover all area, and the open information on the vaccine allocation to the group of the people, which would bring the trust between the citizen and the governments. And in addition, develop policy need to allow citizen, government, and the all sector to the participation. Thank you for listening.
Okay, thank you very much, Kun Kitikun. So a lot of digital divide that must be not overlooked if Thailand is determined, as you said, to not leave anyone behind. So not only do we need to protect against the infection, but also we must try to close the wider digital gap, digital divide that Kun Kitikun said in the post-COVID era. Okay, thank you very much. Now we move on to the next presenter, who is Kun Panyarat Wantong, who will be talking about vulnerable groups and the stride of equal rights under the COVID-19 crisis. Okay, you can start now.
Thank you, Ajahn Warat ka. Please, I could to share my screen right now.
While we are, waiting for the technical portion to be sorted out, maybe I can circle back a question to the chair, Ajahn Warat. You spoke about, crisis communication, and one of the issues, that I didn't think you quite brought up was, I think you presented it from a state point of view. What's your view about citizen media literacy? I mean, it's a two-way understanding of the comms around crisis. I'd like to hear your thoughts about the role of media literacy in also contributing to a more clearer understanding of crisis and communication.
Good question and very hard to answer, but it plays a big role in helping or hurting the infodemic, because we are all learning together, I think, all over the world. I mean, this is the pandemic of the large global scale, and the infodemic seems to be as big as the disease itself. So I have seen so many supposed to be smart and literate people passing a lot of misinformation in my line groups and in Facebook and social media. So when the crisis hits, I mean, it's back to what people believe in, the biases and the very basic belief of each people of what you want to believe. So this is beyond literacy, I think, but we are still learning, and we need some kind of education and basic root of how the principle of thinking in as early as childhood, which we are trying to instill in required education system. So it's hard to say, but we need more people who will come out and debunk misinformation and help clear up some of the rumors and fake news that are around during the crisis.
Okay,
so
thank you very much. Yeah. Thanks for trying to finagle and answer. So much appreciated.
okay, we can see your slides now.
Okay, thank you so much. Thank you, Ajahn Chanansara, so much. Right now, okay, get started. First of all, thank you for the opportunity to be a panelist on this conferences. My name is Panyarat Wantong from NIDA, majoring Communication Arts and Management Innovation as a PhD. And I'm currently working as a lecturer at Kasem Bandit University on Digital Media and Content Faculty. Okay, please follow me and let's do this together. First of all, I would like to mention about the COVID-19 pandemic has the largest effect on the economy and societies, and is exposed violence to people in and outside the country, especially to people in poor households and a vulnerable population whose health, insurance, and security are less than general people. Although the government sector has attempted to set out remedial and assistance measures for taking care of these people, the severity of the COVID-19 situation continues. According to the crisis of the COVID-19 pandemic, a lot of changes are found in Thai and world societies in every aspect to the economy, society, politics, and ways of life. It is questionable that when the crisis ends, how to change the world does, how the vulnerable population is affected, and how they receive remedies from various measures of the government and related agency. Next slide, please. Next, I would like to describe about the definitions of vulnerable person. Vulnerable person refer to people with diminished autonomy to protect their rights and benefits due to their lack of power, education, resources, strength, and so on. The examples of vulnerable persons are students, prisoners, incurable patients, elderly people in the nursing home, unemployed people, poor people, homeless people, urgent party minorities, migrants, children and youth, and patients with mental sickness. So next slide, please. The situation of vulnerable groups and health right in Thailand right now, around in 2017, in the research had to vulnerable youth group consist of 7.2 million children, and elderly group include around 880,000 elderly people. So poor people in Thailand was about 5 million, and female prisoner group was about 50,000 people. It's so many in Thailand. So people in this group may be a migrant children, poor children, or children with status problems too. Next slide, please. All right. In this conference, I would like to focus particularly on access to health rights. Health rights cover public health services and other factors with effects on health, such as access to health information, sufficient clean drinking water and food, and accommodation. Health rights were closely related to other human rights, such as rights for food, accommodation, work, education, information, access, and participation without discrimination. From this point, the vulnerable groups cannot access to these things, conclude pension, working, or get a job, main resources, such as education, basic need, especially, and a limitation to health services. Example from the problem in the vulnerable group in Thailand, example about a pension for the disability person, around 30 US per month, and they have to unemployment, and the main result about the education, about the health service, and limitation to access health service too. Okay, and the next slide from a research, the purpose way to synthesize lessons learned from the existing community-based health development for vulnerable populations in Thai context. From a macro perspective, the cause of bad health in this population group are from lack of chance and inaccessibility to main resources. adapting to resource of each population group depends on 3 factors as follows. At the first, services. Are services, they receive services with quality and fairness, or how much do the services respond to their health problems. Second, government's policy. Do the government and related agencies have measures or guidelines for interventions, accessibility by everyone, or do they leave anyone behind? So, and 3, assistance measures. The government and societies should take care of vulnerable households, especially the households with multiple vulnerabilities, more than general households. So, and 4, remedial measures. About the project from the government เราไม่ทิ้งกัน it means we don't leave behind. We don't leave behind by provide to 5,000 baht per person in 3 consecutive months in coverage of 6.9 million vulnerable people. And the last consideration should be put particularly on the vulnerable groups with awareness of long-term consequences and preventing various groups of people in societies from getting hurt. So the Thai social gap has continuously expanded since the start of the first National Economic and Social Development Plan. This gap is apparent from the political crisis in 2007 until the present. Vulnerable population become a concept that refers to the population group and risk of health problems more than the general people, and they have limited chances to access health services facilities. Although the universal health coverage insurance in Thailand is hopeful for more accessibility to treatment than ever, the relationship among the above 3 factors of vulnerable people have inter-effect more or less. As a result, with the spread of the COVID-19, vulnerable groups are heavily affected no less than other groups. So, in this slide, the vulnerable groups are, thank you. The vulnerable groups are risk groups to get a lot of effect from the COVID-19 pandemic. They should be the first group to get help. Okay, please, next slide. However, with several limitations, the government assistance measures do not cover all people. When the pandemic re-emerges with serious economic effects on a wide range of people, the vulnerable population face more and more life difficulties. Last, I would like to suggest additional measures to relieve and cope with the effects on the vulnerable groups during and after the COVID-19 pandemic to maintain their equal rights to other groups of people in societies. These measures are from discussion and suggestion from the literature review or the research on the dissertation and other news on the project of the government. First, I give to support all local mechanism apart from the government sector, such as foundations or NGOs, which work closely with the vulnerable groups. This includes volunteers to find the target groups and to inform them about information and communication during the crisis and to solve problems directly. Second, to focus on the vulnerable groups without income or employment is done by helping them get work. For example, the loan process from order funds and funds for disabled people should be accelerated for them to use in their career quickly. The funds debt settlements should be expanded and the payment should be made with reasonable interest without increasing debt burdens. And the last 3, to develop an information system in coverage of the vulnerable groups around the country is done by searching different types of vulnerable groups quickly and accurately to solve the direct problem quickly. This is one of the important strides for the equal rights of the vulnerable groups to cope with other people or other future challenges. Thank you so much.
Okay, thank you very much, Kun Panyarat. Okay, so we have heard of the term human rights that the COVID-19 pandemic has taught us. Another term, which is the health rights especially for the vulnerable groups which are lagging behind and would need to be addressed, as well as other people. We have heard the term lately. We have heard the term universal prevention, which is from the angle of preventing or controlling. But maybe another term that we need to hear is the universal health rights for people with vulnerable. Okay, so although we had some technical difficulties, we're still on time. So we move on to the last presenter, Khun Ploy Srisuro, under the topic of digital citizenship, the hand-in-hand practice of educator and parent during the COVID-19 pandemic in Thailand. Okay, time is yours.
Thank you, Ajahn Warat. Let me share my screen. Everyone see my screen?
Yes, your screen is clear. Thank you.
Okay, good morning, everyone. I am Ploy Srisuro. I'm a PhD student at the GSCM NIDA. I am currently working as the lecturer at the Faculty of Mass Communication Technology at Rajamangala University of Technology, Thanyaburi. Today, I would like to talk about the digital citizenship and the practice of educator and parents during the COVID-19 pandemic in Thailand. Oops. Okay. First, I'd like to briefly talk about the meaning of the digital citizenship. Common sense kids action gives the meaning of the digital citizenship as an age-appropriate use of digital tools to have a positive impact on personal, family, school, social, and community life. Meaning that digital citizenship goes hand in hand with the education of the media literacy. According to International Society for Technology and Education, to be a complete digital citizen, students should hold some important abilities. First, an ability to cultivate and manage their digital identity and reputation, and to be aware of their actions in the digital world. Second, the ability to engage with positive, safe, legal, and ethical behaviors when using technology. Third, an ability to demonstrate an understanding and a respect for the rights and obligations of using and sharing intellectual property. And the last one, the ability to manage personal data to maintain digital privacy and security. So in short, digital citizenship refers to the ability to think critically, behave safely, and participate responsibly or actively, as well as the ability to use digital resources and technology and to evaluate digital tools, content, and impact. In other words, our kids are able to use the proper technology and be able to make safe, responsible, and respectful online choices in their life. Digital citizenship has been translated into curriculum in many topics. For example, internet safety, privacy and security, cyberbullying, digital footprints, and information literacy. So teachers should teach all these topics in school, and students should learn about this topic in their classes as well. When we talk about the digital citizenship, it's related to an online society. Let's take a look at number here. According to data published by Thai Health Promotion Foundation, this is an online survey of 1,300 Thai children aged 8 to 12 years old. The results show that 60% of Thai children face online threats, compared to 56% globally, and compared to our neighboring countries, which are Philippines 73%, Indonesia 71%, Vietnam 68%. They all have higher number than us, and Singapore, which is 54%. So we are a bit higher than the global average. And when we look further to the data of the internet usage, Thai children spend 35 hours a week browsing the internet, which is 3 hours more than the global average. And if you divide 35 hours by 7 days, you would get about 5 hours per day, which is a lot. So when children spend more time on the internet, they are more likely to face online threats. There are 4 types of online threats that Thai children face in their digital lives. The first one is cyberbullying with profanity and edited images account for 49%, followed by links to online pornography and talking about sex with a stranger, 19%, online game addiction, 12%, and being tempted to meet stranger, 7%. Moreover, there are many studies investigate how students use new media and how these new media affects their online lives. The results of most studies are in the same direction, showing that children spend more and more time online. Therefore, it is important that children develop skills that help them to safely identify, analyze, and share information, as well as to ensure that their online activities are healthy, ethical, and legal. As now we all know that we are living with the COVID-19 virus. In Thailand, the Center for COVID-19 Situation Administration, or CCSA, was formed to offer Thai citizens several recommendations on how to avoid the transmission of the virus. CCSA and the government have begun to apply social distancing measures similar to those used in other countries across the world. However, until recently, it also forced shutdown of all educational sites, which have now transitioned to an online instruction. COVID-19 has had a direct impact on the education sector. According to the social impact assessment on COVID-19 in Thailand, the study on the access to learning materials showed that 50.8% of respondents said that they do not have a computer, laptop, or tablet at home, while 26.3% said that they do not have enough or any internet at home at all. According to the quality of learning materials, TV education for young children in pre-primary or early primary levels is in poor quality and relies on memorization learning techniques. Furthermore, excessive TV viewing may not be acceptable for young children because we do not want our children to be in front of the TV all the time. In terms of teacher readiness, few Thai teachers have received training on utilizing technology to offer remote education, and the rapid shift in teaching medium is highly hard. So teachers still need some help to adjust themselves. And for the last one, for the infrastructure, many smaller schools, both in urban and rural areas, lack the adequate financial, educational, and technical resources to successfully facilitate remote learning. So there are numerous studies on online learning and the difficulties that have arisen as a result of the pandemic. As you can see, the main problem is that children or students do not have the device to access to the internet, or they do not have the internet connection at all. However, if they do have internet access, they spend much of their time on social media, online gaming, or other activities that are not related to education or knowledge seeking, which leads to additional online risk or issues. So to help students develop their ability to become digital citizenship, teachers should be encouraged and educated so that they are knowledgeable of the required skills. Teachers should be able to incorporate the digital citizenship topics into their classes and to help students appreciate the effects of technology use. For school, it should be well prepared to include the topics of digital citizenship into their curriculum. For example, the topic about pornography exposure, sexting, cyberbullying, and digital literacy. Moreover, school leadership and administration should be in charge of resource allocation and management. For the government, it should act as a policymaker, creating the policy or plans that support the on-site, online, and mixed learning. It should continue building an internet or infrastructure for learning. And the governmental policy must reduce technical gaps and societal divisions created by age, race, ethnicity, income, and education to achieve more digital participation. Besides teachers and school, parents and families play an important role during homeschooling, such as ensuring that their children follow the curriculum and emotionally supporting their children to maintain their motivation and ambitious goals. At home, parents should encourage their children to use digital media in a safe and friendly environment. They should also teach their children how to use, comprehend, and build an online manners. They should talk to their children about their emotions and thoughts on the rules of using new media. Do not need to force strict controls on the children. Parents may educate their children to read like fact checkers, which means to read laterally, leaving a site after a brief scan and opening additional browser tabs to assess the credibility of the original site. The process is for navigating misleading data, fake news, and destructive speech. Children will be able to distinguish between opinions and facts, find important claims, and then access them without having to finish the original text. Another idea that parents should introduce to their children is the scout mindset, which creates feeling of curiosity, pleasure, and intrigue when children are seeking new knowledge. Parents should encourage their children to be more curious about the facts they discover. Children, like scouts, should be more likely to express joy while looking for new information or overcoming a problem. Parents must demonstrate to their children that it is exciting to stumble across something that challenges their ideas. So in conclusion, it is critical to pay great attention to the subject of digital citizenship in the community of children and young people who are extremely active internet users. The educators and parents need to work together to improve digital skills for children who are the foundation of a sustainable democratic society. We need to make sure that when our children are connected to the internet, they think critically, behave safely, and participate responsibly in the digital world. This paper was only investigating the statistics and data available online. So in terms of future study, qualitative and quantitative research must be conducted to find more empirical evidence. A research that carefully explores the roles of parents, students, and teachers in the context of online learning to understand the obstacles that students experience when learning to become the digital citizenship. Also, a research that looks more deeply at the suitable curriculum utilized in school, from kindergarten to higher education, and the activities to be used at home. Thank you.
Okay, thank you very much, Employee Sisuro. Wow, very interesting. And we still have 4 minutes left. Very good time management. This topic really hits home with me because as I am not both, but also a parent, educator, and helping the CCSA, and someone who always wanted for the critical thinking in children. So very interesting, and a lot of homework to do at Employ to make it happen. The next question would be how to make it, how to make it happen, how to make it the reality. Okay. Thank you very much. So we are at about 10:30, 10:26, and we have about 30 minutes for the Q&A questions for our panel, our 4 of us. Anyone has any questions, please put it in your chat box or just raise your hand. Yes, Kun Nukila, right? Were you raising your hand? Kun Nukila.
Okay. I forgot to turn on my mic. Okay, I would like to thank you very much for all of you for your presentation. It is really interesting, and I have some questions for I would like to read the name for Miss Punyarat because you're presenting about the vulnerable group. I would like to mention that I think everyone during this pandemic situation is vulnerable, and in my opinion, can be categorized as a vulnerable group also in terms of health rights, yeah, and also our social rights. For example, in this pandemic situation, we can be lose our jobs, we can be unemployed, we can be poor, and so on. So I would like to ask you the question for you: how to address this by the policy, by any other effort to address these two vulnerable issues in terms of social issues and vulnerable in health issues. That's my first question. My second question all right, what is the first? Kritikun? Yeah, I would like to because I put on my chat. I forget the question in my in the chat. Yes, the digital divide can cause the inequalities in terms of education and employment and any other sectors. I read about your presentation from your PPT that 40 million do not have access to internet. My question is how to what about the literacy of internet for those 40 million people, right? Correct me if I'm wrong. And also how to address also this issue. Thank you.
Okay.
Okay, so Kun Punyarat, you may want to go first.
Okay, thank you so much for your question. It's very interesting. When I did the research and about the dissertation from literature review, I found that about the government policy and so much about the research in Thailand about the vulnerable groups on the next part before COVID-19 coming. And right now, COVID-19 coming pandemic is very spread in Thailand on around the world. I think about the address policy in the government from only my opinion. I think it should be to the suitable from the vulnerable groups because in Thailand it's very so strong about the culture right now. But when they didn't help or the cannot to accessibility for the health services or they didn't have to the ID card, the nation in ID card or unemployment or the mental illness in the sickness. I think the policy in the government is not suitable in their on the situation of there, and so they have to do project in Thailand. เราไม่ทิ้งกัน it mean we don't left to the other behind. They have to bring some patients about the COVID-19 go to home in the hometown on the outer province, another in the Bangkok. So such as in the province is Surin. Surin is not as in Thailand. Is they have to a lot of the COVID-19 patients. Yes, this government I think is very nice and very suitable in Thailand because in the Bangkok they have to a lot of people so go to the Bangkok for the get a job and the education. But when the COVID-19 spread out, in the hospital is not so for the enough for then they have to the healthy on the healing. Yes, I think the address about the policy is more policy and consideration about the equal rights for them more than more other jobs, because the humanity is equal. They're the equal with the other people. Yes, I think so. Thank you.
Okay, so that's the second question for Kun Kittikun.
Okay, thank you for your question. Yes, I said there's 70% of the Thai citizen don't have the computer to access, but I think for your question, digital skill or the media literacy is the very important. And the Thai and I think I suggest the Thai government need to support this media literacy through the education, to social new media or something like that. And I found that in Singapore have the project Sing Tell the project. This project they support the senior the person, and they have the volunteer to teach digital skill the pandemic, such as the people they can't shop online, people answer their healthcare. I think the literacy is very important, and the main to the video, the digital divide is the policy from the government. Thank you.
Okay. Does that answer your question, Nikila?
Yes, thank you, Warat. Thank you.
Okay.
Where
are you from? Where are you from, Nikila?
I'm from Indonesia.
Nice meeting you, Nikila. Okay, next question. I have someone raising her hand. Kun Punchada.
Yeah, I'm good. Okay, can you hear my voice, right?
Yes.
Okay. I'm Panchada from Mahidol University. I have a question for Dr. Warat, right? Actually, the moderator. Your first presentation, you said that you was invited by the government to join the communications team about the COVID-19. But right after the the so-called things, and then the speakers of that organization has started to trying to give information for the peoples about the COVID-19. There was a lot of criticize about the team and the government, how to deliver the information to the public. So in your, as a person who give them, advise them at first, do you think what are the weakness, after your advice? And do you think that how many percent, if you have to present it, that this team is successful in order to communicate about the COVID-19 and vaccine distributions to public? Thank you very much.
Okay, thank you. Like I said, communication is only a part of the management of this crisis, this whole disease crisis. And as I said, I found out that one of the few major flaws is that we don't have a system of communication in crisis in place. We have the public relations department or Kromachanampan as the major responsibilities for airing and announcing news and things like that, but we don't have the connection, the really connection with other units of the government. So it's very hard to keep all the people in line and saying the same things. At first, in the first few months, everybody was listening to Dr. Tawisin, but it had become increasingly difficult because to communicate, sometimes it depends on the situation also, because when it's good, then everybody is is happy and we can listen to Dr. Tawisin. But as the situation has worsened, there'll be more frustrations, and along with the COVID-19 fatigue and the consequences of shutting down businesses, people are out of jobs, things like that. It becomes very hard to communicate on a positive note. So as I concluded, our only tools are to tell the truth and be as open as possible, which I asked one of the advisors. There are many advisors. I'm only one of the advisors. I try to tell them to be as open as possible. And some, I mean, these are sensitive issues. These are national issues. So some could be done. Some are, fell on deaf ears. Some are lost along the way. So, but we have tried as much as possible. I mean, Dr. Thuy himself in the first few months has been very accepted by the public, but as it has been increasingly difficult, it was hard for him to say anything, because once he said something, there'll be people who would try to attack him on the opposite side, because it has become somewhat a political issue. So out of 10, I think we have done something right, something wrong, and there are very key lessons to be learned. And from my communication point of view is to take communication seriously, especially with the level up the top people, to be very concerned about trying to make communication system as effective as possible, because it's not only about speaking to people, but it saves lives. Thank you. Anyone else who has any questions? We still have some time.
Ajahn Warat, maybe I could ask a few questions to the panel. I have maybe 2, 3, maybe 4, one for each of you. Let me ask, I have 3 questions for our doctoral candidates, and then 1 naughty question for you, Ajahn Warat. So again? I will ask you first, and maybe you could answer last. So Ajahn Warat, I take your point. I think we all do, but the truth will set you free. So in the current climate of political unrest in Thailand, is there research showing the degree to which Thai citizens believe the information that they are getting? That's one. So maybe I'll leave you to ponder that.
Yeah, may I just add on
to
Ajahn Warat? And this is a political question and not a research question. Can we depend on the truth after the CCSA is abolished following the announcements? So that's a research question, and add on a political question. And you have plenty of time to think about it. So over to you.
Sure. Thank you, James. So let me ask 3 quick questions. They're more factual. Kun Ploy, you spoke about digital citizenship. I wonder if there is data showing over the last, 18 months or so, whether the digital responsibility, especially the cyberbullying, has increased, or has it maintained at the same level, and so on, because these are difficult times, and young people in particular have a very hard time addressing these issues. So that's one question to you. To Kun Punyarat, you mentioned, I take all of your points, and in your data, you mentioned data from 2017. So I wonder if there is any more recent data regarding the impact of COVID-19 on vulnerable groups and so on. And the last one is also to Kun Kittikun about data again. Your data, I think you mentioned the 14 million people with no access, and it's from 2020 data. So is there more recent data? And more broadly, can you speak to the impact of COVID-19 in terms of generally access to the internet? Has it gone down? Has it gone up? Have mobile subscriptions gone up or down, for example? Just a general question. So let me leave it there, and maybe we could start with Kun Ploy.
Thank you for your question or concerning. I definitely am sure that there are the statistic about the cyberbullying in the past 18 months, right? Is that you mentioned?
Yes.
Okay.
Yes.
Unfortunately, I haven't looked at that number yet, but I am sure they have the number concerning about the cyberbullying and all the online threats that occur in the country, because we have been locked down, not locked down, but partial
Yes.
lockdown and online learning for quite, I think, almost a year, because my son still, right now, he's still learning his class, online class outside the room. So I'm sure they have a number, and I'm very happy to look at that number, maybe in the future to support my statement. Thank you very much.
Thank you. And maybe
Yeah.
Punyarat.
Okay, in your question about the address about the situation of the vulnerable groups in Thailand after the COVID-19 spread out. Impact of COVID-19 on vulnerable populations in Thailand. I think the situation and impact of COVID-19 reveal that the measures to control the spread of COVID-19 have reduced their income for families with vulnerable populations, increased expenses, and more debt than families without fragile groups. In addition, the number of new homeless people in Thailand increased by more than 20%, I think so, due to the COVID-19 situation right now. So I think almost that in the dissertation or in the 2019, when the COVID-19 coming up to us, the vulnerable groups in Thailand more than people in Thailand. And so after the question and answer for the Kun Nika from Indonesia, I think so the more general about the policy in the government is more and more for the humanity equal to for other people, because each other is equal in Thailand. Thank you.
Let me share a result from, everybody can see this, right? Anita poll had done a poll last month, and one of the question was that, who do you believe in information about COVID-19? And the first was doctors, in the modern doctors. Second one would be the media, mass media. And the third people would be health officers. And then the fourth is traditional doctors and Sobok. Sobok, the main announcer or the main agency, state agency producing measures and everything, came in fifth. So that might answer some of your question that as time went on, the reliability or people listen less to the state, the government. So we need to try to come up with some kind of the dissemination of not the truth, but because truth is very subjective in this type of situation. I mean, it's very interpretive and subjective. So after the abolishment, supposedly maybe this Friday, I don't know, I've heard rumors, I don't know for sure if they will abolish the CSA, but it will be handed over to the health ministry. And as there will be people who will say whatever they want to say. So digital literacy will become even more important in this time, because there are still, even though the situation might seem to be a little better, but they're still in a very tense political situation, and there'll be people who will try to connect the COVID-19 to their political agendas. So I don't know if I answered your question, but we are maybe on our own in trying to literate people around us to become more aware. And as I always say, I mean, you do not have to be the first to know, but make sure that you have gotten the most reliable information. Okay, that would be my answer.
Thank you, Ajahn Warat. Yeah, once again, thank you very much. Panel number one, the COVID-19 crisis and communication challenges in Thailand. We had 4 excellent presentations. Ajahn Warat, spoke about the CCA and the need for truth as a way of convincing the veracity of COVID-19 information, and there is concern how that would evolve. Certainly, perhaps with the move with the Ministry of Health, maybe trust can improve, but then Ajahn Warat, you also caution that some of this truth may be sidelined because of political contestation. Then we had Kun Kittikun, who spoke about the digital divide and drew attention about the have or have not and how it impacts in terms of information being transmitted on the online landscape. And then we have Ms. Punyarat, who spoke about the impact on vulnerable communities and how we should pay attention about the severe impact the COVID-19 situation has had. And last but not least, Ms. Ploy, who brought our attention on the impact on another sector, which is young children, and how they have been exposed to more than usual, on the online landscape, given with the online learning scheme. And she highlighted some of the challenges, including cyberbullying and other concerns that come into the landscape. I think from the questions that were raised, I think there was a request for more current data broadly, and to maybe specifically zoom in how the last 18 months in particular had impacted, whether it was vulnerable communities, whether it was digital divide, or whether it was the impact on young children, so that we can, specifically measure and appreciate the impact on COVID-19. And all of this contributes to how we communicate challenges, and we have an excellent insight to the situation in Thailand. So with that, thank you very much, friends from the NIDA panel.